Hi folks, Dr. Tom Meade. Welcome to a special edition of our show, Living with COVID-19 in the New Orthopedic World. To help me navigate this new orthopedic world is Dr. Eric Lebby, Chief of Orthopedic Surgery at Lehigh Valley Hospital. Eric, thank you for joining me.
Tom, thank you so much for having me. I'm looking forward to it.
This is a great topic, and I can't think of anybody better to sort of brainstorm about that. I have to put a disclaimer up first because we both work for Lehigh Valley Hospital Network, and we are not here to represent them or coordinate health. So we have to put up this disclaimer. We are just here as two physicians with 60 years of experience in orthopedic surgery to kind of give you our insight on this new orthopedic world. And let me tell you, we have a lot of topics that have changed in our world. As you can see on this slide, it's everything from what's happening in Hazleton. We're at our studio in Hazleton, and this is a hot spot in Pennsylvania. So we're going to touch base on that. We're going to look at what happened to elective surgery. That's what Eric and I do. So we're going to touch base on that. We're going to talk about telemedicine, the new way that we actually see patients, inconsistencies across the off the state. Some real numbers in statistics. We're going to talk about the balance between a public health issue, economics, our COVID-free hospital. When did you ever hear about that? Well, we have 3 of them, and we're going to talk a little bit about that, the new norm in the offices. Coordinated Health had some big events, Athlete of the Year, some virtual injury centers. What happened to those? We're going to bring you up to date on all these things and hopefully touch on outpatient total joints and even a favorite topic of Eric and mine, which is nutraceuticals that help with our orthopedic patients, but even ones that boost the immune system. So all that, let's get started. Before I get started, I do want to mention a few things about Dr. Lebby. You know, like me, he was educated at some of the finest institutions in Pennsylvania. He was a bison, an owl, and a Quaker. So he actually came by Hazleton on his way from Philadelphia.
I gotta say, Tom, I was a temporary Quaker for a year,
but
I was an owl.
Oh, you were an owl?
I went to Temple Med and Temple Residency.
I said that. I said a bison, an owl, and a Quaker.
And a Quaker, yes. Quaker was my fellowship, yes.
Yeah.
So you're right. Yeah.
So he was a great baseball player at Bucknell. He had to travel past Hazleton on his way from Philadelphia to Bucknell.
Correct.
Then probably spent 9 years at Temple, if I'm doing my math right.
9 years, yes.
Great,
nine great years.
Great institution, great medical school, great orthopedic training. And then he went to the Ivy League for a year and actually trained at Penn before he ended up where I ended up at Lehigh Valley.
That's right.
We have a lot of common denominators there. I did trauma for 15 years. Eric runs that department, which still is one of the busiest level 1 trauma centers in Pennsylvania. And then we both are sort of into the natural approach for our patients. So that being said, what a new world.
Yeah, and you know, I think what I like about Tom and what I think we do very similarly is, you know, we're orthopedic surgeons, but we really think about the whole patient. And you know, we're not just knee doctors or hip doctors or orthopedic doctors. I look at ourselves as physicians that really care for the entire patient. You know, whether it's the nutraceuticals, whether it's the way that you carry yourself every day. And that's what I really enjoy, our 2 philosophies that are very intermeshed in that sense.
I do, but the world changed for us, Eric. I'm just looking at this timeline. The first case of COVID-19 was in China in December. Then in January 20th, we had the first case in this country. February 29th was the first death in this country. Then March 11th, it was declared a pandemic. It seems like we've had this pandemic for years going on. March 13th, March, April, May, 2 months ago, it was declared a national emergency and it was shut down on the 19th of March. It's only been going on for 2 months, but it's changed our life in orthopedics.
Yes, it has. Absolutely.
It's changed our life. And we're sitting here in Hazleton. I have to put up another slide that was in the paper, that Hazleton is actually a hotspot. This was an article, as you can see, that was in the Times Leader newspaper. Of note, as an aside, it was my first job as a paper boy with the Times Leader in Pittston when I was 11 years old, so I just have to throw that out there. But in Luzerne County, we're here in Hazleton, over half of the cases are here in Hazleton. If you look at the reasoning, it's the same sort of reasoning where the hotspots are in New York. The Latino population is now 60% of Hazleton. There's, just like New York, there's a lot of multi-generational houses. You have close quarters, you have close housing, and the job market here was actually very good. It's at the crossroads of the country, Interstate 80 and 81. So they have the distribution centers. The bad part of that is you have people coming back and forth from New Jersey to New York. There's a bit of a language barrier, and it was actually on 60 Minutes last night. It's on 60 Minutes. So, because the Amazon Center here did have a bunch of cases. So anyway, we're in the middle of a hotspot, but I want to assure that both Eric and I have tested negative, and
Multiple times now.
Multiple times. We have to test. We'll get into that in a little bit. Once every week to keep our patients safe at a COVID-free hospital. But indeed, our world has changed, as you can see from the props in front of Eric. Pick up that N95 mask, Eric. And this is what's called an N95 mask that you've heard about.
Yes,
And
this is what we have to wear now.
we have to wear.
We have to wear, you know, for those of you that have seen Tom operate, I know I've watched the show before, and I've seen him wear this, so you guys are familiar with our spacesuits. But we have to wear the spacesuit, and not only do we have to wear the spacesuit, but now we have to wear this mask underneath. And it's not easy. It's not easy doing, you know, the amount of cases that we do a day and having to wear this. It's kind of like, you know, running a marathon inside of your suit.
Oh, and we actually have to wear a mask on top of that so we don't contaminate it, and so we could save these masks, or else, you know, they are in short supply. And actually, our President Trump, is coming to the Lehigh Valley this Thursday because of the N95 masks.
The production.
One of the productions and the distribution center
is in Emmaus, I think?
It's in Upper Macungie.
Upper Macungie, that's right.
It is in Upper Macungie. Yep. So we are attracting a lot of attention, but that's just one of the masks. And here's one of the masks that we use routinely. So all day long we are now using masks. And I'm going to shamelessly promote one of my patients, as you can see.
I think it's a great thing. I mean, anybody that does anything to help today, that's anything but shameless.
Yes.
Not a Penn State fan,
right?
But
Bucknell was so close.
It is.
You had to go to Penn State on occasion when you played baseball.
Every once in a while. Every once in a while we went to Penn State.
But you know what? We do this for our patients. We love our patients. Every day we get, when our patients come in, and she sits home, she's not working, she's sewing these things, and she made them custom for me, but she made one for our staff, a cyclist. I mean, these are wonderful, wonderful patients. So her name and her email's on the slide. So if you need it or you need a custom one, email her, and she may get one. But all the other props are here. The most important one is is soap, the simple thing, soap and water, and we have a tape measure, and we'll tell you what 6 feet looks like.
There it is.
There it is. But we did test, so we're close.
We know we're safe.
We know we're safe, but we, you know, it's a new world. So, you know, to shamelessly promote some other things, another Lehigh Valley physician actually is one of the proprietors of 8 Oaks, a distillery. They were one of the first in the country to actually convert their distillery to a hand sanitizer. And here it is, 8 Oaks hand sanitizer. We use it often. Bruce Nicholson, head of pain management, one of the top physicians at Lehigh Valley, wonderful pain management guy. So stick with us. We'll be back in a minute, and we'll touch base on some other important issues that have changed our world because of COVID-19 in orthopedics. Welcome back to our show. My guest is Dr. Eric Lebby, Chief of Orthopedic Surgery at Lehigh Valley, discussing the new COVID-19 world of orthopedics. One of the the things that changed dramatically for us on March 19th was the governor shutting down a lot of non-essential business, but they shut down elective surgery, which is really basically what I do. Eric still is doing some level 1 trauma, but the majority of
not as much anymore.
Yeah, no, you know, it is it's a fun when you're young, and your first decade or so, but it does get a little old. And you know, orthopedic world has changed. When we used to do everything, you and I were talking about it, we would work all day, we would do trauma at night, and
then wake up the next morning and do the same thing again.
And do it again. Now, fortunately, our profession has gotten smart. We have specialists that are actually better at it, because that's all they do.
Yeah, we have 2 traumatologists at Lehigh, and they're fantastic. And you know, we see a lot of really difficult traumas throughout really the tri-state area, actually, that come to our network. So, and now that coordinated is with our network, we've just gotten all that stronger. So it's exciting.
Trauma started at Lehigh Valley, first trauma center in the state. Mike Rhodes, great traumatologist. His brother, great physician, one of the best infectious disease doctors. I look at him like Dr. Fauci. Dr. Pat Rhodes is the Dr. Fauci of Lehigh Valley.
Oh, by far.
He is the most well-read, smartest ID doc I've come across.
When I need to know something regarding ID, that's the guy I call.
So they shut down elective surgery. Eric, we've been not doing elective surgery for 6 weeks. Just this past week, we started again. But in the downtime, what kind of cases did you do? What kind of cases were you able to do?
We at Lehigh were still doing traumas, and we were doing the level 1 cases.
But you have to.
So a level 1 case means that if we don't do that case, it's going to seriously alter your life or end your life. So we, throughout this entire pandemic, were doing the level 1 cases and some level 2 cases, which are cases that need to be done, you know, within a week to 2 weeks. And the great thing about it is, looking back at the statistics, none of those patients that we operated on came down with COVID during that time period. So that's a good thing to report.
You know, it's interesting. I was just on a conference call with outpatient total joint surgeons around the country. And one of the biggest groups out in Seattle actually just looked at over 300 cases that they did as an outpatient during the COVID pandemic with no other specific precautions. And as you just reported, just the precautions they took in identifying patients and stratifying them if they qualified as an outpatient total joint patient, none of them came down with COVID-19.
Yeah, it's amazing. And the other thing, Tom, that I find very interesting is we kind of stratify these cases into level 1, level 2, level 3, and level 4. And obviously, for some reason, the total joints, whether it's a hip or a knee, always end up as level 4. And a lot of patients of mine that I talk to, and I know a lot of yours, would beg to differ, because although it might not be life-saving, it surely is life-altering. And waiting, 6 to 8 to 10 weeks to get that joint done after having waited for 3 months, there's a lot of things that you can end up with that are just as bad or worse than COVID. Inactivity, taking extra pain medications, taking extra aspirins or taking extra Advil or Aleve, causing GI bleeds, causing issues with your blood pressure, causing issues with swelling of your lower extremities. So a lot of this COVID crisis where we weren't allowed to do these elective patients, I really feel that a lot of those patients fall into this quagmire of what's going to happen to me now and what do I have to look forward to in the future. And that's what's so great about us having these COVID-free hospitals that you were talking about. And now we can offer the care that we need to give to our patients, yet do it safely, effectively, and us, along with them, regain the trust.
So yeah, it sounds like we have a little bit of a different opinion than other folks about elective and non-essential surgery.
Correct.
Because it's interesting. In our world, there was controversy on the national news media where some of our orthopedic surgeons were going ahead and doing important surgery. Some of them were actually had the argument of, I'm going to do a sports operation on a Major League Baseball player's arm because he needed Tommy John surgery.
Sure.
And he said, you know what? this is an important part of his life. His career is not that long. And if I don't do this now and he rehabs for 6 or 12 months, it's going to take a year out of his life. And I appreciated that argument, but you know what? I have the same argument with my patients.
Absolutely.
My patients are a plumber. My patients are electricians. And you know what? I would argue that his knee or his arm is as important as that professional baseball player getting paid millions of dollars. But for him to get back to work and support his family is absolutely critical. And so, as you said, I call it the silent price that our patients have paid for putting off this elective surgery. And you hit the nail on the head. You know, there's a spectrum of people with symptoms, and when they come in with swollen knees and sore backs and sore hips, you know, they have to do something, and you pay a price because they don't want to do opioids because we're aware of this opioid crisis. So what else works? Well, acetaminophen and anti-inflammatories. 20,000 people a year, you know, are dying of non-steroidals. You know, we've hit 70 or 80,000 people with COVID, but we don't bat an eye that 20,000 people die from non-steroidals. The major cause of non-alcoholic liver disease and liver transplants is excessive use of acetaminophen. And that's what our patients are living on. There's a silent price, just like inflammation. And
what about our number one killer in the world? Cardiovascular disease. Heart disease.
Yeah.
So all of our patients that are now sedentary and dealing with increased inflammation, because we know that if your joint is inflamed, there are other parts of your body that are dealing with chronic inflammation, like our hearts. So these patients that we have sitting around idle, where are their increased risks? Cardiovascular disease, you know, and it's like I say, everybody we fear, and we have had this fear towards COVID and the death rate, but we forget that the number one killer is still cardiovascular disease, Tom. If you put a ticker on the bottom of your TV and marked and made a little tick every time someone died from cardiovascular disease, it would be every 37 seconds. Yeah. Imagine how people would feel watching TV and seeing that ticker every 37 seconds, another death, another death.
Yeah.
I mean, imagine those numbers. Oh. They're scary.
Yeah, there's so many comparisons. It's you know, we can go many different directions here, but I'll think a little bit about. Let me go somewhere else first. Let's talk about your point of sheltering at home. You know, we've learned so much, and sheltering at home and staying at home was absolutely critical, and we figured out a lot of things. We figured out who's at risk. I think the one big mistake is people misunderstood that sheltering at home and staying at home meant staying inside. If we had to remarket that, I would say shelter at home, stay away from folks, use a mask, use social distancing, but get outside every day and exercise, but do it safely. Use social distancing, stay away from folks, but you have to get outside, you have to exercise. It's good for your immune system. I think sleep and exercise are the two things that you have to do. And if you're not exercising, you're not as tired, and I think it was in retrospect, it's one of the things that we could correct. So,
absolutely.
You know, at that point, again, we'll be back in a second. We have some more exciting thoughts to give you. Stay with us. Hi folks, I'm here with Dr. Eric Lebby, Chief of Orthopedic Surgery at Lehigh Valley Hospital. We're discussing living with COVID-19 in the orthopedic world. Boy, so many things have changed. We touched on a bunch of topics. Let me zero back into the day that we stopped doing elective surgery. So in this 6 weeks off, you were doing trauma, Eric, but did you do any hip or knee surgeries, and what kind were you allowed to do during that time period?
Now, in the beginning, Tom, we were allowed to selectively pick certain patients, and that lasted about 2 days, and then breaks went on, and we couldn't do any surgery anymore. And I've had, just like yourself, we have patients that wait 3 months for surgery, right? So they've been waiting 3 months, and now you have to give them the news that that joint replacement that was going to restart their life, we can't do now. And Now that patient that's been sedentary for 3 months, or God knows how long before that, now has to be sedentary for how much longer? And how is that going to affect the patient? You know, and Tom, we were talking about the physical side of things. Imagine what this pandemic has done to people on a mental side, right? So you're a patient that needs a joint replacement. You know, yes, it's damaging you physically, but what's it doing to you mentally? What's it doing you from a depression side of things? And before the last break, you mentioned two things that are very important: sleep and exercise. And nutrition, I think, are the three most important things in staying healthy and safe. So now you have a painful joint. How are you going to sleep properly? How are you going to end up eating properly? And how are you going to be able to exercise? You're going to be 0 for 3. And you know, the pandemic has lasted another 6 weeks, and we're just starting to get back into it again.
Yeah.
So there's a large number of patients that are really missing out, and you and I both fear that these patients are slipping through the cracks. And what you and I need to do is grab these patients and prevent them from slipping through those cracks.
Yeah, I agree. The only case, I think I only did one case, and it was a severe infection. So I did one case in 6 weeks, and that was the only case that I did. And we had patients calling all the time, just asking when this is going to be over. It's amazing. And now, well, you know, once we're back in and running, I thought that, you know, people would be fearful to come back in. They're not. They and especially with our COVID-free hospitals, which I'll get to in a minute. But so in that 6 weeks that was off, did you see patients in the office? How did that change?
It changed a lot. We really didn't see too many patients in the office because we weren't allowed to. But times changed, so we had to adapt. And we started doing virtual visits. We started doing phone visits. And as orthopedic surgeons, you and I both know, we're kind of in a you know, see the patient,
yes,
feel the injury, diagnose the injury, and treat the injury. But what was nice about the video visits, and I think Coordinated did an excellent job. You guys did an excellent job spearheading that front, and Lehigh also has. And what's nice is the video visits kind of gave us that contact with the patients, the visual contact. And I think the video visits are great for both patients and us because we still were able to make that emotional connection, that emotional visual connection with the patient, and still be able to treat people. You know, we were hit with a new element that we never had to deal with before. And I think that LVH Coordinated did a fantastic job of just this new connection with patients.
So we did pivot. I remember. So I think there's a couple positive things. There's always a silver lining to some of these crises.
Always.
And I think so. The first day I was back in the office, I said, "Oh my God, you know, what a difference." So we had no waiting room. The patients were screened the day ahead of time. Mm-hmm. So they were called to make sure that they didn't have the symptoms of a fever, you know, sore throat, shortness of breath. Mm-hmm. So once they cleared that, then they came through the gauntlet. They came through the front door, and they were met with not a smiling, happy receptionist. You couldn't even tell. They had a mask on, and they had goggles, because we really didn't have as many PPEs. So they're wearing goggles, yeah. And now we've just really helped the plexiglass industry, mm-hmm. because everything is plexiglass now. So
I feel you mentioned Temple, right? So you mentioned where I went to Temple, and the interesting thing about Temple, the emergency room, everywhere you go, there's bulletproof glass. There's glass about this thick, you know, because it's Philadelphia. It's Temple. It's right in the middle of the city.
Yeah, safest school in Philadelphia.
Correct. Correct. And it's funny because when I went to Tillman the other day, they have plexiglass, and I said to the receptionist, I said, I feel like I'm back at Temple. I mean, it's glass like this thick.
Oh yeah.
Yeah.
So they come in, and then of course they get their temperature taken again, and it's sort of like a decision-making tree. As long as they pass and everything was okay, if it was,
you go to step B.
You go to step B. Yes, right. It's like a pull-down tree on the computer.
Tree, right.
If they didn't, then we had a plan. If they had a fever, you know, that they would all get a mask, and then, you know, we had a screening phone call where they would call Lehigh Valley Hospital, and they would direct them appropriately for the testing facility. And so then once they come in, we had masks on. I walk in, and you know what the thing I miss the most is greeting patients, shaking their
it's hard.
shaking their hand, and now they have a mask on. I have a mask on, and it's
very awkward in the beginning.
It's very
awkward.
It was very awkward, and because they would go to shake your hand because
you'd
they
be like,
would forget, and you go,
I forget too.
Yeah. And so now it's the new handshake. And really we weren't seeing that many people in the hospital. But you know who I would see? I would see essential workers. Despite, if they had a sore knee, they're working for the post office, they're working in healthcare, they're truck drivers. I said, you know what? Come in the office, I would do whatever it takes. They had a swollen knee, I would aspirate them, I would inject them. If they were an essential worker, I got them in the office.
Absolutely. And and again, what's essential and what's non-essential? I've talked to a lot of people who think that their jobs are very essential, and you can't argue with it, right? It's not just the police officers. My brother's a police officer. God bless him. He does. It's very hard work. And the nurses and the doctors, they're essential, but there are a lot of other people that are essential too. How about the guy bagging your groceries at the supermarket? I think he's pretty essential, or she's pretty essential, right? Especially during these times. So I think that definition can also be expanded many different ways.
So I guess another positive aspect is something that we've always sort of thought was coming, and the virtual visits, the telemedicine visits, but we were just never pushed to do them. And I think it actually pushed us a little bit, and we do see the value in that, especially if we have a patient population from a large geographic area.
Correct.
Because it was a little awkward, and we sort of figured it out. But once people could get on their computer or their smartphone, we would figure it out. And I realized that a large percent of our people, especially if I'm doing outpatient surgery, or you send them home within 23 hours or the next day, you kind of want to see them before 4 to 6 weeks. But you know what? If they're from upstate New York or from New Jersey or down in Philly, so they would drive up. And they would say, God, your knee's good. And you would see them for 2 minutes, go, wow, this is perfect. I wish you didn't have to come here. I wish there was some other way to do it. And that sort of opened the door to virtual visits. And now we're looking for that role going forward. So even though we're seeing patients back again, I definitely see a role, especially with first post-operative patients.
I think first post-operative patients, Tom, and I think another great thing that I've used video visits for are the patients that, like you said, are far away and are looking for a consultation. They aren't pleased with the joint that they have, or they have issues and would like to see you or myself. And normally...
Hold that thought. Hold that thought for part 2 of the special show on living with COVID-19 in the new orthopedic world.